got yours, Facebook, Instagram, Tik, YouTube.
Yep, working on it right now.
Welcome, everyone. You on Tik yet or no?
No, not yet.
You know what's happening across the street, Doc? They give you the back. 2 minutes, lower ab.
Oh, I think Dr. Hernandez is with Barlow, though.
Barlow? Barlow has one across the street?
He does have domino class. He's in paint.
And we are live on Instagram.
Like, not on the right, it's in a different color. Maybe he added that on.
Maybe it's, I didn't see it on the next deck.
And we are live on TikTok. Alrighty, good morning everyone. Welcome. This morning we are here in San Antonio, Texas with Dr. Jeneby. We are doing a skinny BBL and breast implants this morning. If you guys have any questions, feel free to leave them in the comments below. We'll gladly answer them for you. Also, if you click that blue Get a Quote button down in the bottom left-hand corner, you have the chance to receive 24% off on your procedure. But you can only get that offer if you fill out that Get a Quote button during the live.
So maybe the bomb holes. So I guess Hernandez will take those.
Thank you, Word, for the
What's
follow.
the video back to, man?
Good morning, everyone. Good morning, Jim. Good morning, Gonzalez. Thank you for the follow.
1.5 minutes. On.
And if you guys are interested in seeing the full procedure that's being done this morning, we are currently streaming that live over on our YouTube channel. You can find that link in our bio and go to the link tree and press the YouTube button.
Welcome Instagram and Facebook. Story or lives.
We are on Instagram Live right now, we are on TikTok Live, and we are on YouTube right now. Good morning, Jim. Good morning, Carlos.
I've seen a lot of Instagram lately where they're showing a lot of gruesome things, but they just cover the videos. Not live, but
like where they just kind of blur it.
Must be the current content was censored. Like they showed an entire rectus repair.
Wow.
They had covered it, so I'm thinking they loosened up a bit.
I feel like they let some people get away with it, and then other people get hella flagged for it.
It's insane. Like I saw, they showed the entire rectus repair, and we can't.
Good morning, everyone. If you guys have any questions, feel free to leave them in the comments below, and we'll gladly answer them for you. Also, don't forget to like and share our live. It really helps us out if you do so.
1.5 dots length.
Jennifer, we are doing a skinny BBL and some breast implants today. Are you currently doing some lipo for the BBL right now?
Yes.
Getting all that fat?
The vaser and then the lipo.
And she's getting the Rejuvion? Is that how you say it?
Renuvion.
Renuvion.
When you see that pink cord, that's the Nubian.
Yeah, this is the Renuvion right here. So the black, the gray and the black is vaser.
Jennifer, we're located in San Antonio, Texas.
Sunny San Antonio.
Currently
Always
not
sunny.
so sunny. Freaking freezing right now.
Everybody's like, we open. Like, of course we're open.
Come on, man.
Stop with your, we're dying. Texas doesn't know how to deal with driving. You do, just keep going. Just go slow. Or come in the morning.
Jennifer, people do come from all across the U.S. To come get surgeries done here. And for their surgeries, we do have financing options here as well. So if you are interested in getting a procedure done by Dr. Jeneby or one of the many doctors we have in our surgery centers, go ahead and fill out that blue Get a Quote button down in the bottom left-hand corner so someone from our team can get in contact with you to discuss further about pricing and stuff like that. Doc, Rachel says hi.
Hello. Rachel from Batman. I was watching Dark Knight last night.
Awesome, Jennifer. I'll keep an eye out for your quote
Heath Ledger.
paper, and I'll make sure to send it to our team as soon as I see it.
I think so, yeah. No, not Katie Holmes. It is.
And Jennifer, when you fill out that Get a Quote, just make sure that you write in every procedure that you want to get done. That way our team knows exactly what to talk to you about, and plus you'll have that chance to receive the 24% off by filling that Get a Quote button out during the live.
The samurai are really crazy mafia in that movie. Yeah. I bet you they're watching that movie like, none of that's right. And one guy couldn't do all that.
Welcome everyone. If you guys have any questions, feel free to leave them in the comments below and we'll gladly do our best to answer them for you. Also, just so you know, if you fill out the Get a Quote button during the live, you have the chance to receive 24% off on your procedures with us. But you can only get that offer if you fill that out during the live.
1.5.
Also, if you're interested in seeing the full procedure that's happening this morning, we are live streaming it over on our YouTube channel. You can find that link in our bio in our link tree. Good morning, everyone. Good morning, Ashley. Good morning, Leanne. Good morning, Cindy.
They're cut off. You haven't seen Nicolaja 3 yet?
I saw the beginning. I saw that first one where they sell that whole.
Good morning, Cindy.
And you find out why.
I also hope everyone is staying nice and warm. I know here in San Antonio it's currently really cold. We have our freeze warning going on right now, but I feel like it's like that across the whole U.S. Everyone's dealing with a little bit of colder weather,
Number one, the guy to the left.
so I hope everyone's staying warm.
But I'm really mad. I'm really not happy. I'm really sorry for the guy to the right and his family.
Thank you for the follow, Melissa. Don't forget to like and share our live. It really helps us out, guys. We really appreciate it when you do.
The guy's like, all these guns are moved.
We are currently in San Antonio, Texas. Oh yes, we are still out here.
I think so.
We always have an early morning here
Especially to his head.
in
Hit him in the head.
the OR.
1.5 airplane back. Yeah, just there's a lot of luck in that movie. But it was good. It was a good fitting end.
Good morning, Cameron.
No, dude, they got house.
Good morning, Eric.
NFTs and
Wheat sausage.
wheat.
Oh, look at the butt stick.
No, I predict
Oh, Cindy, thanks for jumping on into YouTube. He is doing some lipo right now for his skinny BBL, and then he's also doing some breast implants.
Actually, we would have got the Lions, because I thought the Rams were going to beat the Lions. You're not. I got you.
You got it? Alright. There it is. On that side then?
Good morning, Heather. Good morning, Gigi. If you guys are interested in seeing the full procedure that's being done this morning, you can head over to our YouTube channel. We are currently live streaming the full procedure. You can find that link in our bio in our link tree. No reason to be nervous, Cindy. You're going to be in good hands. I'm excited for you to get your surgery, though. That's super exciting. I'm sure you'll feel so much better. Good morning, Harper. Good morning, Alyssa. Hello, Lisa. How far in advance would someone have to book to get a procedure done? It all depends on, like, payment, right?
Oh man, that all depends on the surgery is.
Yeah.
How far are you booked out, though?
Yeah.
Several months.
Okay.
You want 50 days?
If you want some of my other guys, they're probably within a month. Every once in a while there's an opening within a couple of weeks, but.
So Dr. Jeneby is booked out for a couple months, and then we have a lot of other really great surgeons here in our surgery centers
Dr. Miami then?
who could probably have availability like in a month and a half-ish.
He was on to you for a while when it comes to channel called weed. Didn't really do very good.
Good morning, Juan. Good morning, Juju. Good morning, T.
You remember 3 times you can write that 15 book.
Those books are very expensive to write. They're like $150 a page. You have somebody help.
You need a chapter 2 because
I know. I know.
You have a lot to write about.
Hi, T. Good morning. If you're just joining us, we are here in San Antonio, Texas this morning with Dr. Jeneby. He is doing some liposuction right now for his skinny BBL, and then he's also going to be doing some breast implants this morning. If you guys have any questions, feel free to leave them in the comments below, and we'll gladly do our best to answer them for you. Also, if you fill out that blue Get a Quote button that's down in the bottom left-hand corner on our TikTok Live, you have the chance to receive 24% off on your procedures with us. And if you're watching on YouTube or on TikTok, you can go to our link tree in our bio and fill out the Get a Quote button. Unfortunately, I can't discuss pricing on the live, but if you're interested in getting a tummy tuck done, go ahead and fill out that blue Get a Quote button down in the bottom left-hand corner. Let us know what all the different procedures are that you would like to get, so someone from our team can get in contact with you to discuss pricing and also financing options as well. Good morning, Vanessa. Good morning, Christina. Good morning, John. Good morning, Ron.
You guys do your the injection BBL for the spa yet, Dr. Evans?
I made the graphic last night, so I've got that going, and then I'll be getting videos with her this week for it.
Dr. Evans?
Yeah, with Dr. Evans. Kind of getting some videos of her just explaining what the procedure is and kind of how it works.
Yeah. She's done it for you. We need to see some pics.
She's done it. She's the only one who does the Sculptra, at least to my knowledge. And she has a couple patients who are currently getting it done
200 lower ab?
for their face.
Okay. Make sure we maybe get an interim view. Have her take pictures of it before and after on the next ones that she does.
Okay.
And
I will
either
let.
take a video or a pic and send it.
I'll let her know. I know the women who are getting it are older women, so I don't know how comfortable.
You know, you can ask.
Yeah, I'll make sure we ask, but
Well, I mean, we gotta have some before and after.
yeah. Well, right now, the rep they were seeing for the Sculptra, she has a lot of really good pamphlets and stuff.
Okay.
So we're gonna get some of those from her.
Okay.
That way we can have them.
Put that up.
Yeah.
Put a graphic up. It's very visual.
Yeah.
Plastic surgery is visual.
Plus, like when we were discussing like the plan and stuff, like the package and everything, we were looking at a whole bunch of videos of people getting it done as well. So
Okay. You take those and inject for the injection.
yeah. The needles they're using for the injections are different than what we would be using, but the
200,
results are the same.
Mom.
Good morning, everyone. If you're just joining us, we are here in San Antonio, Texas with Dr. Jeneby this morning.
Wow, almost a liter, Doc.
He is currently doing some liposuction for a skinny BBL, and then he will also be going in and doing some breast implants today. If you guys have any questions, feel free to leave them in the comments below, and we'll gladly do our best to answer them for you. Also, if you fill out the Get a Quote button down in the bottom left-hand corner, you do have the chance to receive 24% off on your on your procedure with us. And if you're interested in seeing the full procedure that's being done this morning, you can head on over to our YouTube channel. That link is going to be in our bio in our link tree, because we are currently streaming the full procedure over there. Congratulations, Em.
Team Man 1 Iowa.
We're super excited for you to come in and get your surgery done soon.
Who? Yeah. The Brotherhood.
Dr. Genevieve, Josephine is asking if a mini tummy tuck or some lipo is better.
Oh, you have to come in for a consult. I won't be able to tell.
Yeah, that's what I was thinking. We won't
Be able to tell just talking to you without seeing it.
It's always,
They both have pluses and minuses, right?
yeah, always best to have a
Always best to do
consult.
virtual. You
Yeah.
do one today if you want. Say you'd like one today, give us some time and we'll call you.
So, Josephine, what I would suggest is fill out that blue Get a Quote button down in the bottom left-hand corner. Let us know what procedures you want to get, and I'll make sure someone from our team sees it. That way we can set up a consult for you. Awesome, Josephine. I will double check that shortly. Shannon is asking about how long does it take to see results after a tummy tuck?
How long is it what?
How long does it take to see your, like, the results after a tummy tuck?
I'll see an immediate result, but then it takes about 3 to 6 months for the swelling to go down, and then 1 year is final. Just don't gain weight in that year. And 80% of you do. So try to stay on your diet and exercise plan. Even though you say you're going to be good, most of you aren't. That's just facts, sheets,
Yeah.
statistics. 150 doc, upper back. Now we're going to go with the lower knee. No, not yet. I'm going to do everything carry out. Now we're going to do a little Renuvion, which will help melt the fat, shrink the skin at 200 degrees Fahrenheit. So that you know a really hot tub is about 140. This is pretty hot.
And that's why it helps shrink the skin.
Yes, it's like the same thing as, you know, when you take chicken skin, you put it in a fryer, it contracts. It gets hard, crispy, right? I try to tell people that when I'm explaining what this does.
No, we are in San Antonio, Texas. And then Emma's asking, can you do the skinny shot after a tummy tuck?
Yes, that helps.
Yeah.
After you're all healed, yes. Come in and get your skinny shot with us.
Do you normally inject the skinny shot into your stomach, or does it matter?
You take a pinch and you inject into the pinch. That's
Okay.
I can show you that today.
Okay, that'd be perfect. Josephine, the skinny shot is a type of weight loss shot that helps suppress your appetite. If you want to go over to our page on TikTok or even our page on Instagram, we do have a couple more videos helping explain that shot as well. But it always comes highly recommended to a lot of our patients who have a higher BMI. To help out with the surgeries. Oh, that's really good to hear. I'm glad that you can still see the body contour after, what, 3 years now? That's awesome.
That's awesome. You've maintained it.
Yeah.
147 doc upper. Ready?
And Josephine, by the way, I do see your lead that came through, so I'll make sure someone from our team gets that shortly. Let's see. Would you say that it's common for someone to get a revision done on like a tummy tuck and stuff like that?
Oh yeah. Life changes. Your weight. Like I've done tummy tucks on people who are at 1.212 pounds. Now they're 193, and they're like, "What happened to my tummy tuck?" I'm like, "I told you to get to a stable weight."
Yeah. And the skinny shot helps you kind of keep
stay
the
at that weight.
Yeah.
Or even get better. I had a lady I did. She was 215 pounds. Now she's 193. She's like, "Well, I have all this extra loose skin." Well, like we discussed, doing a tummy tuck at a high BMI, and then you start losing weight. Guess what? You need another one.
Yeah.
And I warn people. What can I do? I can only warn you. Give you the pros and cons.
And then is the skinny shot the
1.0 doc, lower ab. Ready?
Is the skinny shot the semi-glutide?
Yes.
Okay.
Or terzepatide, which is semi-glutide plus GIP. So semi-glutide is like Ozempic, Wegovy. Terzepatide, there's a new one out. Well, terzepatide and Zepbound are the same, but they have a GIP, which tells your mind to shut off your appetite center, right, Docky?
Yes.
You really don't think of food other than I should eat, but I haven't eaten all day.
Yeah.
It reminds you have to remind yourself to eat. You're really not hungry, which is perfect. But because diabetics have a disorder, how insulin is processed,
Yeah.
you're chronically hungry. You become a slave to food. And I hear that a lot. Almost everyone here at the office is on it.
And then B is asking, are skinny BBLs worth it if you have trouble gaining weight?
They are worth it. They actually look really good. As long as you don't want something too big.
It really all depends on what you want, which
1.0 Mons, Docky.
our doctors are really good at double, triple checking, making sure they're
definitely
asking
worth
you
it.
what you
They
want.
actually are beautiful. You're not going to have a huge butt, but you'll have a firmer butt. That's what you care about.
We are doing some lipo right now
Is
for
that
a
from
skinny.
Instagram or face? Or?
That is from TikTok.
Oh, wow. Just tell us where they're coming from. And ask questions.
Okay. We are doing a skinny BBL today, so he's doing the lipo right now for that. And then he will also be doing some breast implants today.
Here's the Betty Boop surgery. Remember Betty Boop? None of y'all know who that is.
I do. I remember that.
She's like an anime. She has a large bust and a large butt.
And then from TikTok, Vanessa is asking, how do I get the skinny shot from y'all if I live in a different city?
We have it shipped to you.
There you go.
So go ahead and hit the DM, and then we do a telemedicine visit, and then we get you labs, and then we go from there.
So you can fill out that get a quote button so we can have someone from our team get in contact with you with more information about getting that skinny shot. And Barbie, do you mean
1.2 blank.
do you mean reverse or revise a tummy tuck? Because he does
There's
revise.
no reversal of a tummy tuck.
Huh?
There's no reversal of a tummy tuck.
That's what I was thinking. So I think she means revise.
Right, yeah.
Yes, he does revive tummy tucks. I actually was just in a surgery with him, I think last week, of
Yeah.
him revising a tummy tuck scar. Betty Boop is very pretty. She has goals.
Yes, she is. She's pretty a cartoon character.
So is Jessica Rabbit. She is very beautiful too.
Yeah, Jessica Rabbit. Yes. They're both similar.
And Vanessa, if you're interested in getting that revision done, go ahead and fill out that blue get a quote button down in the bottom corner. That way someone from our team can get in contact with you to discuss financing and pricing and all that kind of stuff. Schedule you a consultation. That way we can get that revision done. And thank you for the follow, Water.
1.0 dog. Upper back. Turn. 1 second. We just a little bit more lipo and then we can quit. Taking all the liquid fat that now the Reunion has blessed us with. She's gonna look really good, this girl, because she's young, tighter skin, no stretch marks, no children.
If she does choose to have children, how will everything pretty much disappear from what you've done on her stomach today?
Okay, now you can turn, Doc. Did I do the vaser on that other side or no?
We've done vaser.
Okay. Now I have to do lipo, right?
Hello, Nettie. Nettie is saying hi all the way from Germany over on our TikTok.
B Gates, that's Germany, B Gates. Means basically, what's up? German.
Oh gosh, she said something back in German and I don't think I'm going to pronounce it right.
B Gates.
That's what she said.
Yeah. Of course, the famous Ich Stein du hast einen schönen Tag. It means thanks for watching for this video. Dr. Ketchup and I learned German over the years, right, Jockey?
Nice to have all the guests from out of the country on our social media.
So Barbie, you're talking about more on your like upper abdomen? Dr. Jeneby said there's not really anything for a reverse tummy tuck. It would just be a regular tummy tuck or a revision. If you're wanting something done on your abdomen, I would. If someone wants something done on their abdomen, that would be more like their upper
Yeah.
would be like sculpting,
Lipo,
right?
could be a
Lipo.
reverse tummy tuck.
Okay.
Could be a lot of things. But again, make a consult or virtual. Make it today. We did have some cancellations. If anybody wants a quick one today, just to get your curiosity peaked. $200 length.
Okay. I'm sorry, Bobby. I misunderstood.
A lot of people staying home because of the weather.
I don't blame them. It's freezing outside.
Wimps.
Temperature this morning
Uh,
is
Tay-
15 degrees.
Yes, Barbie, we do offer.
I like that my
We
whole
do
life.
offer it. We do pretty much
Really?
all the plastic surgeries
It's
here.
snowing where my
So
sister
go ahead
is.
and fill out that
Thursday.
get a quote button down in the bottom corner.
It's snowing in Philly and it's
That way
snowing
we
in
can
New
schedule
York.
that consultation for you,
Temperature in Lubbock is 1 degree
and
right
give you, pricing
What?
and options for financing and stuff like that. I'm so sorry, I
Lubbock is
misunderstood.
it's
My
almost
bad.
just Midwest, right?
Tay, we are located in San Antonio, Texas.
Yeah, that's like Midwest.
San Antonio is 16 degrees right now.
Thank God we're a little bit more south than Lubbock.
So Vanessa, as a part of our packages, they do have a hotel
100
package that you
upper
can
back.
purchase when you're putting together all your surgery and stuff.
Thursday is 69 though.
It really depends on where you're coming from.
Like, where did this blast come from? Right?
Yeah, it's weird, the weather pattern.
Comet is coming, that's why. Comet's gonna come and wipe us out.
If someone's coming from out of state and they stay in the hotel, how many weeks do you suggest they stay in the hotel before they
for
travel
a mommy
again?
makeover, at least 2 to 3. Or something smaller, maybe a week. BBL or breast dog, maybe a week. Then we give you a shot to thin your blood before you get on a plane or in a car. Because it's not so much you can't make it, it's blood clots that are dangerous during travel. Remember, up in a plane you have reduced cabin pressure, right? So the veins dilate. There's turbulence because you're sitting. Not turbulence from an airplane, but turbulence in the veins. So we'd like to keep you safe. So listen to the doctor. Anywhere between 1 to 3 weeks. But we don't know until you actually tell us what you want and come see. Big mommy makeover is 2 to 3 weeks.
Yeah, so Vanessa, all really depends on what you want to get. So think the more surgeries you get,
Yeah.
the
more
longer
you
you'll
have
want to
work on.
stay. The less surgeries you get, the less time you would have to stay. But it sounds like about a minimum of a week is what is recommended for the least amount of surgery. Let's see. What do you suggest? This is coming from our TikTok. What do you suggest for a chin tuck for someone who has keloid skin? So like all those little growths.
Oh, well, I mean, lipo has the smallest incision. Most controllable incision. A big neck lift, you're going to have a long incision behind your ear and along your hairline. So there is a risk, obviously. One on 1.5, left flank. Ready?
And then from our TikTok, Josephine is asking, when doing lipo, how long do you recommend wearing the jaw, which I'm assuming is the wrap that you have to wear?
Say that again. Oh,
The
people
wrap
wear
that
it
you wear after.
3 to 6 months. Some people say 6 weeks, but you'll feel like wearing it longer.
Did you ask our doc about that, or did you go to someone else? Because Monica's asking from our TikTok, she wants a tummy tuck done, but after her 3rd C-section, a doc
Okay,
said
Doc, 1.5.
she had a ton of scar tissue.
Oh, that doesn't matter. I've got people with 5 and 6 C-sections.
There you go. So no need to worry.
No.
No need to be worried about it.
There are some doctors that do plastic surgery and some don't. Right?
Yeah.
I've done women with 6 or 8 C-sections.
Yeah, Monica.
I've done people who've had other abdominal surgery. It doesn't bother us.
So if you want to fill out that, get a quote button down in the bottom left-hand corner.
All right, guys, we're going to do
Do it now, so you can get that 24% off.
And then hit this DM button, or I'm sorry, to get a quote for 24% off the procedure, but it has to be in the next 20 seconds. So count down for you.
All right, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thanks guys so much, and we'll see you in a little bit.